Hi, Dr. Paul Connolly here at the Bedford Center for Prosthodontics office in Bedford, New Hampshire. Just want to talk to you guys today a little bit about All-on-X, All-on-4, or implant bridge therapy, questions, concerns, or things you might want to ask your providers. Some of you might be watching this from outside of the New Hampshire area, Massachusetts area, so you might be wanting to find your own dentist in your area. So these are the things and qualities that we have here. This therapy is very complex and should be done with somebody who's highly skilled and experienced. So I have 20 years of experience doing these procedures. So we've done all sorts of patients and arches and smiles and rebuilding tons of people with this All-on-X therapy. I'm highly trained in both the surgery aspect, so I'm helping patients take out the teeth, doing bone grafting, placing the implants, as well as placing the final teeth, restoring the smile and function again. So we have both training aspects to this procedure. We have a lab here on site. So we are making on site our temporary teeth and working to making our final teeth here in the office. So we have lots of control over the process to make sure we're using the right materials and getting the right final product. Speaking of materials, one of the most important things is realizing what materials the final teeth, the final All-on-X bridge is going to be made out of. A couple of options is some people will make them out of plastic acrylic teeth, which can look good and function for a period of time, but unfortunately after 2, 3, 4, 5 years, those teeth are going to wear out very quickly. I have patients, just fixed one this week, where a tooth popped off of the bridge because of the lack of strength and bond. The tooth chipped right off. We were able to put a new one on for her. She was really happy, but the acrylic teeth are not as strong and do kind of chip off sometimes. What we use here for our final bridges are a titanium substructure or a framework, and on top of that we put zirconia teeth. Both of those materials are extremely strong, extremely durable, and gonna last you for a very long time. Way outlast the time frame that you would for acrylic or plastic teeth. All-on-X is very important terminology in our office because we design patient-specific dentistry, meaning sometimes we use 4 implants, but if we can, we'd rather use 5 or 6. That gives us more strength to the final bridge, more strength to the implants in total. We also have technology here to help us learn where we're going to place the implants. We have a system called RayFace that gives us a 3-dimensional viewing of a patient's face, so we know how the future teeth are going to fit within their smile and with their overall face. That is extremely helpful for us in our planning process. So we're able to start and plan from the moment we start making our impressions with our intraoral scanning machine. Without the goopy impression material, we're able to help design the right number of implants, the right position of teeth, the right color of teeth to get the patients the smile and the function that they're looking for. Also, we do have varying levels of sedation for whatever patients might need for them to feel comfortable going through those procedures. Some of our patients just like to be numb but fully awake. Some of our patients, we use some oral sedation techniques. And finally, we do IV sedation with the help of an anesthesiologist that comes in from an outside source. If any of this sounds interesting or you want to learn more about these steps, please send us an email, give us a call to Bedford Center for Prosthodontics.